Hi guys, Dr. Loretta here. So by the end of this video, you're going to know the common signs and traits of high functioning autism. And by the end, I will show you a few things you can do to help yourself or someone you suspect to have high functioning autism. But first, we need to go over the common signs. About 1% of the global population has autism spectrum disorder. There have been arguments about the increasing rate of this disorder. From a scientific standpoint, we know that the expansion of the diagnostic criteria of the DSM-5, increased awareness of this disorder, increased mental health awareness, and increased access of care can be a contributing factor to this increase. This disorder exists across all race and ethnicity. Symptoms of autism are seen from ages 12 to 24 months, but can be seen earlier, with boys being way more likely to be diagnosed than girls. Symptoms of this disorder frequently involve language, like not talking, not responding to their name when being called, poor eye contact, and odd play pattern. Autism is not a disorder that gets worse over time. You only notice more of the delay as you get older. Autism can be diagnosed at any age. However, if this happens in adulthood, there will be the need to talk to a parent or caregiver to establish that these symptoms were present in childhood and are currently sufficient to cause impairment in social, occupational, and other important areas of functioning. Some individuals present with lower level of impairment and are able to function independently, which is what is typically referred to as high functioning autism. They go to school, successful, are usually seen in science and technology, math, and physics. In the past, autism used to only be diagnosed when symptoms are severe. However, currently, it captures all range of the spectrum from mild to severe, grouping them all into the autism spectrum. You may still hear people without clinical background use the term Asperger's or high functioning autism, or people who were diagnosed in the past before the collective grouping of all these disorders use this term. You might ask, what are the causes of autism so that I know how to prevent it? There is not one specific risk factor for autism. However, people who have kids at a later age in life, genetics, and I would like to add, any substance use in pregnancy can cause this. Now, here are the criteria for autism spectrum disorder. A persistent deficit in social communication and social interaction across multiple contexts as manifested by the following, mind you, currently or by history. 1. Deficit in social emotional reciprocity, ranging from abnormal social approach and failure of normal back and forth conversation. To reduce sharing interest, emotions, or affect, to failure to initiate or respond to social interactions. This is the ability to engage with others to share thoughts and feelings. They present with little to no initiation of social interaction. 2. Deficits in nonverbal communicative behaviors used for social interactions. Poor ability in communication and understanding of verbal and nonverbal cues and gestures. Abnormalities in eye contact outside of cultural norms, body language deficits in understanding and use of gestures, to lack of facial expressions and nonverbal communication. They experience language deficits from complete lack of speech, through language delays, poor comprehension of speech, echoed speech, and even when these skills are intact, the use is impaired. 3. Deficits in developing, maintaining, and understanding relationships, ranging from difficulty adjusting behavior to suit various social contexts, to difficulties in sharing imaginative plays or making friends, to absence of interest in peers. B. Restricted repetitive patterns of behavior, interest, or activities as manifested by two of the following, either currently or by history. 1. Stereotyped or repetitive motor movement. Example, seemingly strange or unusual behaviors or habits. Example would be hand flapping or finger flicking. The use of objects, spinning coins, lining toys, or repetition of speech, in some cases not necessarily meaningful words, or parroting words they heard, like they hear you say come, and they just continue saying the same words repeatedly without context. Pacing repeatedly in the same manner or in the same space. 2. Inconsistency of sameness, inflexible adherence to routines, or ritualized patterns of verbal or non-verbal behaviors. Extreme levels of distress is experienced at small changes in routines, difficulty with transitions, rigid thinking patterns, the need to take the same route every day, eat the same food every day, and watch the same videos repetitively. 3. Highly restricted and fixated interests that are abnormal in level of intensity or focus. Example would be strong attachment to unusual objects. 4. Hyper or hyposensitivity to sensory input. They present with extreme reaction to things like sound, like you see them closing their ears, to textures, excessive smelling or touching of objects. You'd see indifference to pain, heat or cold, or unusual interest in sensory aspects of the environment, like being fascinated by lights, spinning objects, like you will see them hyperfixated on a light bulb just staring at it. This sensory overload can lead to them having a meltdown. Before we continue, if you're yet to, please take this moment to like, subscribe, and share with your friends and your loved ones so they can join us on this journey to mental wellness. Also, if you stick to the end, you'll be learning other diagnostic criteria and treatment options. C. Symptoms must be present in early development period and may not fully become manifest until social demands exceed limited capabilities, or may be masked by learning strategies. D. Symptoms cause clinically significant impairment in social, occupational, and other important areas of functioning. And E. These disturbances are not better explained by intellectual disability. People with so-called high-functioning autism meet the same criteria as everyone else. The difference is in the level of severity and impairment. This diagnosis goes from mild, moderate to severe with varying IQ levels. Severity of diagnosis is based on social communication, impairment, and restricted repetitive pattern of behavior and level of support needed. This disorder can have other specifiers like intellectual impairment, language impairment, associated with other neurodevelopmental disorder, mental or behavioral disorder, and catatonia. That is, that they are slow to talk, language comprehension is behind the growth curve, same as some basic life skills like toileting. Motor deficits can be present, like delayed gait, clumsiness, walking on tiptoes, or other abnormal motor gaits. Some may present with self-injury like head banging, needing to wear a helmet to prevent potential head injury or concussion. You could see full or partial catatonia, mutism, posturing, grimacing, and waxy flexibility. Because of how early in age the onset of autism presents, it is valuable for parents or caregivers to be able to identify early onset of symptoms in order to provide early intervention. Your child's pediatrician can pick up on this during their wellness visits and start monitoring them, or notice it during their developmental screenings. This conversation is to create awareness so that you know when to seek help, know what help and resources are available to you, and to be able to provide support to your family members or friends and loved ones who have a family member or who themselves are experiencing this. Services are available to you through your insurance or through the state if you live like in the United States. Some of such services needed are like your pediatrician for wellness visits, who is usually your first line of care. 2, child psychologist or social worker to provide behavioral therapy, applied behavioral analysis aimed at promoting positive behaviors and reduce unwanted behaviors. Also provide cognitive behavioral therapy. The social worker can also serve as a case manager to help connect you or your child to resources that are needed and advocate for you. 3, speech language pathologists to help to improve their ability to interact and communicate with others. 4, medication management. Not in all cases, in some cases, sometimes to manage the behaviors or whatever other issues the child presents with. 5, occupational therapy to help with skills and specialized tools to aid their disability. Things like assistive devices, specialized pencils to write with, and aid them in using their hands, their legs to write, to move. 6, physical therapy for exercises that build motor skills, strength, balance, and posture. 7, recreational therapy like music, art, and pet therapy. Other resources include childcare, special education through the school district, support groups, and therapy for the parents to ease the stress and learn how to engage their child. None of this information is intended to self-diagnose or for you to diagnose your child. The sooner you get help, early intervention can start to teach skills to help with functioning. Talking to a professional is always an answer. You can never go wrong with therapy in the hands of the right therapist.